Well, hey guys, today I want to talk with you about plaque psoriasis. As a dermatologist, I see so many patients suffer from this disease, and it is my role to help them find the treatment that is right for them. That's why I'm excited to be partnering with Dermavant on this video. VTAMA tapinarof cream 1% is an FDA-approved steroid-free topical prescription medication used to treat adults with mild, moderate, or severe plaque psoriasis. It's actually the #1 prescribed branded topical treatment for plaque psoriasis in adults. Keep watching because we're going to be discussing more about this treatment and how plaque psoriasis may have an impact beyond the skin. Plaque psoriasis is a chronic skin condition causing patches of raised, inflamed, and red skin with silvery scales. As with other chronic medical conditions, plaque psoriasis can affect other areas of a patient's life besides just their physical health. Plaque psoriasis can take a toll on one's emotional health, relationships, and how they handle stress. Patients with plaque psoriasis are more likely to become depressed. Research demonstrates that plaque psoriasis is highly stigmatizing. Now, this can lead patients to feel isolated, lonely, and ashamed. Coping with plaque psoriasis flares can be stressful for patients, and stress can actually trigger flares, as well as make itch worse. Itchiness from plaques can also disrupt your sleep, which can create a vicious cycle for patients. Managing stress, sleep, and itch are all super important components of comprehensive plaque psoriasis care. Many people wrongly assume that the skin lesions of plaque psoriasis are contagious. They are not. This can lead people with plaque psoriasis to feel isolated from their peers, family, and friend groups. A recent survey by the makers of VTAMA cream that included 800 adults with plaque psoriasis and 800 family members of patients with plaque psoriasis showed that only 42% of patients with plaque psoriasis are comfortable receiving physical touch, and 75% feel deprived of physical touch from others because of their disease. It may result in decreased frequency of intimacy, leaving plaque psoriasis sufferers less satisfied. Plaque psoriasis goes where you go, including to school and the workplace. People may make unwelcome comments about plaques. This can really impact someone's mental health and can even influence the clothing they might choose. Patients with plaque psoriasis will seek out clothing to cover up and hide their skin. As a healthcare provider, it's important to me that my adult patients feel comfortable discussing the full impact of their plaque psoriasis. It is important to choose a plaque psoriasis treatment that is right for their symptoms. There are many great treatment options out there, but if a treatment doesn't address the aspects that bother a patient the most, then it's not going to be necessarily the best choice. And treatments are only effective if patients use them. For that reason, it is important for me to listen to patients about what issues and struggles they may have with a given treatment. Some patients find certain formulations to be challenging and don't like using greasy creams and ointments. VTAMA Cream's vehicle is a water-based cream designed to minimize skin irritation. And in a large clinical trial, most patients said that VTAMA Cream absorbs quickly and was not greasy. Now, we all lead super busy lives these days, and for many patients, a complicated regimen that involves applying treatments to the skin more than once a day might just not be realistic with their lifestyle. The last thing I want to do is add more stress to someone's life with an overcomplicated treatment regimen. I really like that VTAMA Cream is a once-daily topical treatment. In fact, 83% of patients said they would use VTAMA Cream again or continue to use it, and 84% of patients said they would recommend VTAMA Cream to others if available. The results speak for themselves. In clinical studies, patients who use VTAMA Cream achieve significantly clearer skin as early as 4 weeks, and up to 40% achieve clear or almost clear skin in 12 weeks compared to 6% of those who used a cream with no active ingredient. Patients also experienced a significant reduction in itch as early as week 2. Patients who achieved clear skin with VTAMA Cream and stopped treatment stayed clear or almost clear of plaques while off treatment for a median of about 4 months. I hope you found this video helpful for better understanding the full impact of plaque psoriasis. If you suffer from plaque psoriasis, be sure to talk to your doctor about your condition and see if VTAMA Cream might be right for you.